Hello everyone, my name is Dr. Seun Explains. I am a chiropractor and a biomechanist, and I work a lot with injury prevention and rehabilitation. I am a firm believer in the ideology that it's not always the most talented athlete who finishes first. A lot of cases, it's just the healthiest athlete who finishes on top. So how do we keep our athletes healthy? How do we keep our athletes able to continue performing at the highest level, to have a shot at getting these scholarships to these Division I universities or Division II? Or how do we continue to allow these professional athletes to continue signing these contracts and renewing and extending their careers? Well, a lot of that is we have to get back to the data. There is so much truth in the data because the data will not lie to you when it is performed properly. So with DorsV, I get data, lots and lots of data. This data helps me analyze the speeds at which the legs and feet and hips are moving. It allows me to analyze the angles at which the hips and the back and the ankles and the knees are performing. And as a biomechanist, what I do is I then take those numbers and I break them down into everything that the athlete has told me. So it'll start first with a history. Has the athlete had any injuries in the past? Have the athlete been experiencing any pains, any tenderness, any tightness, any differences side to side when they do certain motions? Because as we all know, we are usually more dominant on one side than the other, and this is a natural and normal phenomenon for all individuals. But when you're doing repetitive activities, a lot of times we need to be able to balance it out so that the other side isn't left behind. As most athletes can tell you, it is the weakest side that is going to determine how well you perform. So when these athletes tell me what they are experiencing when they perform different activities and different movements, I'm able to integrate that into what the data is telling me. For example, if an athlete complains about having left ankle pain, well, chances are most of their tests are going to show that they're overusing their right side, and that's because they're avoiding using that left side. So although they may be feeling that pain in that left ankle, by overusing the right side, what they're ultimately also doing is creating potential injury in any of the right side along the kinetic chain from their ankle to their knee to their hip to their low back. These overcompensatory patterns are things that we can identify in testing like DorsV. So this is how I use DorsV in my practice when I'm working with athletes from all levels. This is something that's helping to revolutionize sports medicine in a way that helps not only the athletes, but the parents and all the coaches and support staff. It helps everybody understand the best ways to help each individual athlete. We can meet them where they are and take them where they're trying to go.